We're going to talk about a serious medical problem today: bone and joint infections. Let's get into it.
Think about your skeleton. It's your body's foundation, right? But it's not invincible. So, what actually happens when nasty bacteria manage to invade that foundation?
Well, the damage can be really severe. We're talking permanent, life-altering stuff.
Okay, so there are two main types to know. One attacks the joint, the other attacks the bone itself. First up is septic arthritis. This is an infection that gets right inside a joint, usually the knee.
And you'll know it. It's intense pain, swelling, warmth, and you can barely move the joint.
Then you've got osteomyelitis. This one is an infection in the actual bone, often in kids. So this leads to a pretty important question. Who is most likely to get these infections?
It's often the very young or the elderly, or people with weakened immune systems from other conditions.
And the main culprit is usually a bacteria called Staph aureus. It's a threat across pretty much all ages.
And for kids, this is no joke. It's considered a true medical emergency.
So how do doctors even figure out what's going on? How do they find these things?
It's basically a detective process: exams, imaging, lab tests, and sometimes a direct sample.
Okay, so once it's found, how do we fight back? Well, the treatment really has two parts. First things first, you have to get all that infected material out. That means drainage. And part two is the counterattack, hitting the infection hard with powerful antibiotics. But this isn't a quick fix. We're talking at least 2 weeks of IV antibiotics, sometimes more.
But here's the good news. If it's caught and treated fast, a full recovery is absolutely possible.
So the key takeaway is this: for these infections, time is literally everything. Acting fast saves lives.
Which kind of makes you wonder, right? What other silent emergencies should we all know more about?